And you might also, I'm wondering if up in the corner there, if that's an expander. So up in the right-hand side, there's two arrows pointing away from each other. That might expand it.
Okay. And then I think we're live.
Perfect. So I'll get started here in a couple minutes. We can let people trickle in, and then I'll start us off here soon.
So you're able to see the presentation on my screen here?
Mm-hmm. Mm-hmm.
Okay.
Welcome, everyone. We're just going to give it a couple more minutes, let people kind of filter in, and then we'll get started here in about 2-ish minutes here. All right. Well, welcome everybody to our webinar. This one is going to be focusing on breast cancer-related lymphedema, prevention and treatment strategies. I'm Julie. I'm the Vice President at RangeMaster Shoulder Therapy. We're very excited to have you guys all here and excited to learn more from Dr. Shelby, who's also here with us. Just a quick little background for those of you who maybe might not be aware of who we are. So at RangeMaster, we design, manufacture, and distribute shoulder therapy tools for all kind of phases of the shoulder recovery process. So we have tools that help you with range of motion, stretching, and strengthening. And then we make tools for clinic as well as for people to use in-house as well. So we're your partner in shoulder health and patient outcomes for that. A few things before we start the webinar. There is on the bottom right-hand side of your screen, there's a little chat button, so you can click that and feel free to put any questions that you have in there as the webinar is going. We're going to go ahead and answer those questions at the end of the webinar, but feel free to post the questions in there and then I'll go through them and Dr. Shelby will be answering those for us when we get to the end there. So without further ado, I'm going to introduce Dr. Shelby here, who's been working with RangeMaster for a few years now. She's based in Florida, and she will be leading you guys through the webinar today. So take it away, Dr. Shelby.
Hi, everyone, and welcome. I have my screen shared, but if for some reason you're not able to see it, if you want to shoot us a message in the chat, just let us know. We have our tech wizard, Eric, on standby to help us if we need it. But yes, we are doing this presentation today, this webinar on breast cancer-related lymphedema, specifically prevention and treatment strategies. Here. Bear with me, I am definitely technologically challenged. Okay, so just to give you a little bit of information about myself, I am a Florida licensed doctor of physical therapy. I've been practicing for nearly 9 years now. I've worked in both the hospital and currently outpatient physical therapy settings, primarily treating my patients with lymphedema and orthopedic issues as well, such as those related to the shoulder. Half of the patients I work with my lymphedema population are those who are currently undergoing or who have been treated for breast cancer. So I'm very passionate about this topic because unfortunately, I still find with most of my patients who are referred to us, many of them have never even been told that they have a potential risk for lymphedema. And the first time they even hear the word is when they come into our clinic, which is very unfortunate. So that's why, especially with this webinar, we really just want to provide education and bring awareness to everyone, whether it's you yourself who are going through treatment or have been through treatment for breast cancer. Maybe you have a friend, a family member, someone you know who they kind of pop in your head. Oh, I think that maybe they would benefit from learning this as well. So that's ultimately the goal of our webinar here. I do have all of my training for my lymphedema knowledge primarily through the Academy of Lymphatic Studies, where I'm a certified lymphedema therapist. I've had additional training through advanced lymphedema management and am a LANA certified therapist, which means I'm board certified through the Lymphology Association of North America. And then I've had additional training with various orthopedic hands-on techniques, which I find also helpful for my patients with lymphedema. So that's just a little bit about myself there. Now let's just start right out of the gate here. What is lymphedema? Because this is a term, if you've never heard of it before, it can be a little intimidating. Now, if you've been around the medical field or maybe have had any issues with injuries before, maybe you've heard the term edema. That's the medical term for general swelling. So when you see lymphedema, it's telling you that it's swelling specifically in your lymphatic system. So I always like to give a little anatomy background just to try to visualize the lymphatic system, because it's so much more expansive and broad than I think most are really familiar with. You know, we all know about our lymph nodes, but those are just one tiny part of the lymphatic system. If you think about the circulation, your veins and your arteries, the lymphatic system is just as widespread throughout the body and then some. It's just not technically part of our circulatory system. It works complementary to it. So it plays a huge role in immune defense. That's why whenever we're sick, our doctors will check the lymph nodes in the neck to see if they're bigger or enlarged, because anything that brings any possible threat or attack to your lymphatic system or immune system has the potential to overwhelm and stress the system in that area that's under attack. So lymphedema specifically, swelling and fluid buildup in the lymphatic system is what it is. This can happen because of a direct or indirect damage or trauma to the lymphatic system. Now, with regards to a cancer diagnosis, most are familiar with lymphedema with breast cancer, but mind you, just as a side note, it is a condition that can develop technically with any cancer diagnosis or treatment throughout the whole body. But again, for the purposes of our webinar here, and in honor of October being Breast Cancer Awareness Month, we want to focus in on breast cancer related lymphedema specifically. Now, lymphedema does have a very unique look and physical trait to it that is not the same as other forms of swelling. If you look at an individual who has had a history of current or previously treated breast cancer, and you know that they have lymphedema in the limb, the arm on the affected side, many times you're going to see that the arm, it's lost its normal curves to it. We're used to having a smaller wrist where we can see very defined wrist bones. We can see the normal protrusion of our elbow, and working the way up the arm, it has those normal features. But with lymphedema, you lose those shapes and it becomes more column-like. You'll also begin to notice, if it continues without treatment, some skin changes that are very specific to lymphedema. And we'll dive into that a little bit more throughout the webinar. But just know, really diagnosing lymphedema, while there are different types of imaging available out there to confirm if there's a blockage in the lymphatic system, really a physical exam is very sufficient to be able to properly diagnose lymphedema from a healthcare professional. All right. So I did want to just review the stages of lymphedema here. Believe it or not, lymphedema is actually not staged based on the size of the swelling, which seems a little counterintuitive. But this is basically what we're looking at. If someone comes into the clinic, they've been referred for breast cancer related lymphedema. In order to stage them, this is what I'm looking for when we're doing the physical examination and with their history intake too. So we start off with stage 0. This is where we know that an individual has a history that indicates they could be at risk for lymphedema at some point down the road, but there's actually no active swelling present as of right now. It's considered a dormant or latent stage. Because we have that known risk, though, we can't say that they'll never develop lymphedema. There's still that lifetime risk. But even though there's no active swelling, the individual may notice in the at-risk area some heaviness, maybe fatigue or tightness, especially the more they try to use that arm. And just to touch a little briefly too, as a side note, yes, we're used to describing the arm on the side of the breast cancer as being at risk for lymphedema. But technically, you should know that there is a risk on the same side, front, upper chest, and upper back. The reason for this is because the lymph nodes in the armpit on that side naturally drain the lymphatic fluid on the same side, arm, upper chest, and upper back. So while we commonly refer to the arm when we're talking about lymphedema, because that's usually what's most commonly present with breast cancer related lymphedema, just do remember that technically the front of the chest and upper back on that same side also can have a small risk. Okay, just as a side note there. But again, stage 0, there's no swelling. We know there's risk, but there's no active visual swelling. If someone has stage 1 lymphedema, they've started noticing some mild swelling, but it's what we call spontaneously reversible. It's very off and on. It's not consistently there. And there may be what we call pitting present, where if you press down on any part of the arm that's at risk, or again, chest or upper back, and if we notice it leaves an indentation when we remove the hand, that is called pitting. That's pitting edema. Now, usually stage 1 is very responsive to elevation. So a lot of times overnight, if the arm is elevated on a pillow, or even realistically, if it's just in a normal horizontal position where gravity is not pulling that fluid down towards the hand, then the swelling tends to go away. But the individual may notice then when they get up and start using the arm more throughout the day, that it starts to swell a little bit more. So there's a bit of a back and forth. Aside from the swelling, we don't really notice too much changing with the skin quality itself. So that's stage 1 right there. If we progress to stage 2, the swelling is there, but it's what we call now spontaneously irreversible, meaning it's more constant and doesn't respond to elevation as well as it used to. It's become a little bit more severe. Now, mind you, even though with staging, we don't usually base it solely off of the size of the area affected, it's common as the stages progress that there is going to be more noticeable and visible swelling. But with stage 2, we start noticing some skin changes. And this is, again, what's very unique and characteristic to lymphedema. In stage 2, one of the most common things we start seeing is a term called fibrosis. This is basically a hardening of the skin in all or parts of the affected area. The reason this happens is because lymphedema is not a water-dominant fluid, which seems a little weird. We think of swelling, it's a buildup of water in the body, right? But lymphedema is a protein-dominant swelling. And this is because the lymphatics actually drain and move the proteins that are naturally in the body, and then, of course, what we intake with our diet throughout the body, because they're a larger molecule that the rest of the circulation can't really transport as well. So it's a protein-dominant fluid with some other components. The challenge, though, as those proteins start to become more sluggish, like what can happen with lymphedema and congestion occurs, is the hardening of the skin will happen where those proteins tend to accumulate. And that's when we get fibrosis. Now, at this point, you are technically considered to be at a higher risk for skin infections, such as cellulitis, and for blood clots as well. The final stage of lymphedema is stage 3. This is the most advanced stage. I always tell my patients and request, do not Google images of lymphedema, because it's usually going to show you the worst case scenario, usually someone that has not gone through treatment. And that's the stage 3 here, where you develop what we know very well as elephantiasis. So this is if someone especially has lymphedema in their arm from their breast cancer. You see very large and abnormal folds in the skin, a lot more advanced skin changes where the skin thickens. That's the term here, hyperkeratosis, very hard and thick skin. Papillomatosis, which is basically these warty growths that can develop. The orange is a term that describes the skin texture, where if you think about an orange peel and how it kind of is a little pokey, not quite with holes in it, but that skin texture on an orange peel actually can be present on the skin of the affected area. And you can even develop what we know as lymphoria, which is weeping of clear fluid. Now, just as a side note for the lymphoria, I more so have to dive into this with my patients who have lymphedema in the legs, but I still want to make a note, even for my patients with breast cancer related lymphedema. If you ever have a major cardiac history, in particular of congestive heart failure, even if it's stable, if you're experiencing swelling and you're having weeping occur, you need to contact your cardiologist immediately. This, again, is more a precaution if you're experiencing lymphedema or swelling in the legs. But even still, I say even with breast cancer related lymphedema, you always want to make sure your cardiac status is stable and that this is truly a straightforward situation with lymphedema that we're dealing with. With the stage 3, the most advanced stage, you are then at your highest risk for possible skin infections like that cellulitis and for blood clots as well. Okay, now we are moving on here. More about what really creates the risk and what can trigger the lymphedema. The New England Journal of Medicine describes that anywhere from 14 to 40% of individuals will develop lymphedema due to breast cancer treatment. And that's a pretty broad range, but even the 14% I find is higher than most associate with breast cancer related lymphedema. There have been studies that have shown definitely a very large trigger is removal of lymph nodes. And technically speaking, we look at the higher the number of lymph nodes removed, the higher your risk is. So this is where over the years, surgical techniques have changed and transitioned to try to preserve as many lymph nodes as possible. This is where we get into if an individual requires a full axillary lymph node dissection versus a sentinel lymph node biopsy. So normally with a biopsy, they're only needing to take a very small number of lymph nodes, typically a handful or less. But with a full dissection, there's the chance they could take all levels of the lymph nodes in the axilla or armpit. Mind you, we're born with anywhere from an average of 24 to 36 lymph nodes in each individual armpit. So the more you do have removed, the more of a challenge your lymphatics in that area will have with keeping up with the normal workload of fluid that moves and is supposed to be drained in that area. Now, an article from the Critical Reviews in Oncology and Hematology discussed that the chances of developing breast cancer-related lymphedema after an axillary dissection were greater than 20% versus a 3.5 to 11% chance with a sentinel lymph node biopsy. So this is, again, why providers and surgeons very much will do their absolute best to preserve the number of lymph nodes. But of course, if they find that doing an lymph node dissection is necessary, then they're going to have to do what's needed. But these can be things that are brought up in discussion with an oncologist and with your surgeon as well. Now, postoperative infections are a big trigger for breast cancer-related lymphedema because remember, the lymphatic system plays a huge role with our immune system. Any attack to the immune system in that particular area we're concerned about puts more stress on the lymphatics there, especially if we're talking that some lymphatics have been removed, such with a lymph node biopsy or a dissection. The remaining troops, if you will, are now going to have to work that much harder. So if you then experience an infection that's making them go on overdrive, it puts more stress on them and can potentially lead to lymphedema. Now, I will tell you, I find with many of the patients that I work with, radiation therapy is actually a really big trigger for lymphedema. And I've worked with many patients that are about to, are currently undergoing, or have undergone their radiation therapy. And this isn't something that I've seen necessarily in research, but you also have to look at things clinically too, that if an individual is coming to me and they're being treated for active breast cancer, they know they're going to have radiation therapy upcoming. Maybe they have or have not had a surgery already. One of the preventative measures we'll talk about in a little bit in the webinar is potential use of a preventative compression sleeve. And I've had some of my patients talk with their radiation oncologist about the possibility of using a sleeve while they are going through radiation, even during the actual radiation treatment. Haven't had anyone yet say they've been told no. And I just look at it as, knowing the risk factor with radiation and how much scar tissue can build and damage the lymphatics that are remaining in the affected area. Take all the prevention that you can with it. Now, as a last mention here, BMI. So body mass index does play a role with lymphedema. Reason being is because our fat cells do actually surround our lymphatic vessels. So if we have a higher BMI and therefore a higher number of fat cells surrounding and possibly compressing the nearby lymphatics, that can again create blockage in the lymphatic system and create congestion of fluid that can lead to lymphedema. So considering the BMI and definitely trying to keep a healthy weight is definitely encouraged. Okay, so it's important to recognize with breast cancer related lymphedema that it is a lifetime risk. I've had some patients I've worked with that unfortunately have been very miseducated regarding this and have been told various things such as you only had one lymph node removed, you're not going to get lymphedema, or it's already been 10 years, there's no way you're getting lymphedema. And they're there seeing me because they did develop lymphedema. So the thing to understand when you've had this trauma in this specific area of the lymphatic system, especially if we know there's been direct damage via lymph nodes removed, direct radiation and scar tissue on those lymphatics that were affected cannot regrow or regenerate. So you are then situated with a lifetime situation of being in a bit of a shortage with the lymphatics in that at-risk area. The thing to know though, and this is the hard part with lymphedema, is there's no exact way someone can tell you you will absolutely develop lymphedema. I've seen it literally on all spectrums. Someone who's had every treatment possible for their breast cancer has been in successful remission, never has had lymphedema. And I've had individuals that as soon as they were diagnosed with their cancer and began chemotherapy, they developed lymphedema. So it really is so variable with each individual, right? So that's why it's so important when we know there's this stressor happening to the lymphatics on the side you've been diagnosed with your breast cancer, knowing that there is a potential risk of the lymphedema, and then looking at what can we do to minimize that risk. Now, there's if you're on RangeMaster, we do have a section specifically for our patients with breast cancer who have had breast cancer and the topic of lymphedema. And in some articles that I've referenced to in those posts, have discussed different research that's shown. So for example, here, there's an article reference in Lymphedema Following Treatment for Breast Cancer, a New Approach to an Old Problem. And it actually identifies that most, if they're going to develop lymphedema, will tend to develop it 2 to 5 years after they've completed their breast cancer treatment. This is a blanket statement. Again, it's so different for everyone, and it could happen immediately. It could happen 20 years down the road, and it may never even happen whatsoever. So that's just something to keep in mind. Some studies have shown that 15% of cases can develop even 5 years after treatment completion, and that's within the same article there too. But when we look at, there's a lifetime risk. So what could possibly trigger our lymphedema? Okay, travel's a big one, and this is not just via plane. Although airplane travel is considered a big risk because of the changes in air cabin pressure. Now, this is, again, doesn't mean the minute you hop on a plane, you're going to develop lymphedema. Absolutely not. I had an individual, I remember, that for work had to travel all the time via plane. This was probably more than 20 years after they had been successfully treated for their breast cancer. Never had lymphedema, no signs of it, nothing. Had gone on all of these plane rides, didn't use compression, nothing like that. One plane ride, the same kind of trip she'd taken for many, many years, developed lymphedema, unfortunately. So you just never know. Extreme changes in temperature are a big one. This can go for hot or cold, although I'll tell you a really big risk I see commonly. Granted, I'm in Florida, so we've got 4 seasons of hot. But you know, the heat and humidity are really big triggers for lymphedema in Florida, at least. But like I say, technically this could happen with extreme temperatures in the cold weather as well. If you can find that happy medium where it's a nice cool temperature, those who have lymphedema find that it's actually really well controlled in that type of environment. Now we look at minor or major injuries to the at-risk area. This could be something as small as a bug bite, something very minuscule like that, a micro trauma, or it could be something more serious like a fracture on that side. These are all things that if it creates any type of trauma to the area that we know is already an underdog when it comes to keeping up with its workload in that lymphatic system, and now they have more stress added to the mix, it just becomes easily overwhelmed and may not be able to keep up with that fluid workload and start to get congested and show lymphedema. These next couple with blood pressure and labs are very common instructions that I do hear most of my patients are told, which I'm very happy they're told this, is on the side that you are considered at risk for lymphedema, do not get your blood pressure or labs taken on that side. All it takes is one time, and I've seen it happen before, where a cuff is used, normal blood pressure is applied to it, and lymphedema is triggered. The lab draws, it's the same as even going back to a minor injury such as a bug bite, any type of needle, and this goes the same for acupuncture, in the at-risk area, it could trigger lymphedema. Now, aggressive or repetitive exercise or activity without appropriate precautions. We're going to talk a little bit more about this in a bit, but it's not trying to tell you don't use the affected side. Okay. You need to use your arm, right? You need to use that upper body. But if we're talking about an excessive amount of repetitive, heavy use of that arm when you haven't taken any preventative measures, that can overstimulate that impaired lymphatic system. That's mainly what our concern is there. Now, similar deep tissue massage. So massage is great. We love massage. And a lot of times we think of massage as improving blood flow and circulation because it actually does. But remember, your lymphatics are technically separate from your circulatory system. And if you do a deep tissue massage on the at-risk arm, upper chest, or upper back, yes, you're sending blood flow, but you may send too much at once, and it may be more than, again, that lymphatic system in that one area could handle. So all of this is about possible triggers that could overwhelm this impaired system and how we're trying to make sure that does not happen. We mentioned here again the acupuncture. Same thing, and I like to try to use as many examples as I can. Obviously, I can only go into too much detail because of HIPAA, but I've worked with individuals where they were very adamant that they wanted to get acupuncture. They didn't want to skip an area of the body and developed lymphedema, mild, but developed active lymphedema on that side that was at risk for swelling to begin with. We look at larger, more severe scenarios like infections or surgery. Again, let's look at if you had a major injury like a fracture. Maybe you need to get a joint replacement, a total shoulder replacement. You have frozen shoulder. You got to get a manipulation under anesthesia. These things that, again, can create a traumatic situation around there. Sometimes they're just medically necessary. You can't avoid them, but you should know that it could, again, put stress around that lymphatic system. And just as a brief mention with diet, generally speaking, salt intake has been found to have a correlation with swelling in the body generally. Of course, we do relate that to lymphedema. Although lymphedema is a protein-dominant fluid, it does have a small water component as well as involves our fat cells, cellular debris. So there are a bunch of different components to it, but with that and knowing there's a water portion, increased salt intake sometimes can cause lymphedema to show itself or flare up for someone that does have active swelling. Okay, prevention strategies. So the thing to know with prevention strategies, I can't tell you this is going to absolutely keep you from developing lymphedema if you know you have a known risk for it. But it's a matter of knowing these are possible things that you could do to minimize your risk or maybe even keep the swelling from coming on altogether. And I'll always tell my patients, I want to give you all of the information I can possibly give and then have you choose what to do with it. Because the worst thing that I hear from someone is, I wish someone had just told me from the start that I could be doing something. Knowledge is power. So that's what we're trying to achieve here. So prevention strategies, avoiding certain activities. Some of the things we talked about are triggers like the blood pressure, labs, massage. Avoid known things that you know could trigger that affected side. Now, you've heard me say affected side a few times, right? Lymphedema, breast cancer related lymphedema, but really lymphedema in general is an isolated regional swelling. So for example, if I've been diagnosed with breast cancer on my right side, my right arm, my right upper chest, and right upper back, those are my at-risk areas for lymphedema. It's not going to spread over to my left side. It's not going to spread down into my legs. It's an isolated area. The only time you would potentially develop lymphedema related to breast cancer on both sides is if the breast cancer was affecting both sides or had metastasized. So it is a very regional swelling. Keep that in mind. Now, the use of a compression sleeve. If you do not have active swelling, but I want to be preventative about this. And if I'm going to travel, if I'm going to exercise or use my arm repetitively, maybe I'm about to get radiation therapy and I want to talk to my radiation oncologist about using a compression sleeve. A compression sleeve can be a very helpful tool for lymphedema prevention. Now, if you don't have active swelling, you're in stage 0, right? Things are dormant. You don't need a heavy duty compression sleeve. You're looking for something very minimal. As a certified lymphedema therapist, one of the things I will always help my patients with is finding what is the right compression garment to use. This involves what's the best material, the best brand and manufacturer, the best compression level. If you've ever tried even wearing a basic pair of compression socks, you're usually going to see some numbers associated with it. You might see 15 to 20, 20 to 30, 30 to 40. This is the compression class and essentially how intense the compression is in the item itself. So the lower the number, the less compression. So if we're in that preventative stage, you can use a very lower level compression class, something very light, something very breathable. And let's say I'm about to go on a trip. I'm going to throw that on for getting on the plane. I'll keep it on during the plane ride. Maybe I'll wear it when I get to my destination because I'm in a totally different place than where my body is accustomed to, maybe a totally different weather situation, different activity level I may be doing there than I usually do at home. And I might decide, you know what, I'm at my destination. I don't feel anything going on in my at-risk area. So let me go ahead. I'll carry it with me, but I may not need it. Okay, that's the same with exercise. If you know you're going to do a good upper body workout and you want to help the circulation in that area and that lymphatic fluid move well, you could opt for a compression sleeve. Same thing with during radiation therapy. Now, a sleeve is the most common example of what we utilize for preventative compression. But just know if you're wanting to add the torso into things here, then there are even compression bras that exist. They look a lot like sports bras. They feel like them, but they have medical grade compression. So deciding what type of items you may or will want to have is something you can always do with your doctor and certified lymphedema therapist. Now, moving down here for prevention strategies, we talk about practice of self-manual lymphatic drainage. So this is a big part of treatment and prevention that we incorporate with patients who are at risk or have lymphedema. Now, it's not drainage like with a needle pulling drainage out, and it's not massage because remember, it's not deep tissue. Manual lymphatic drainage is a very light technique, hands-on technique that is meant to mimic the natural flow and movement of the lymphatic fluid in the body and encourage it to move to healthy parts of the body that we know are not at risk for lymphedema. So let me go back to my example. If I was diagnosed with right breast cancer and I'm practicing self-manual lymphatic drainage to prevent lymphedema, I'm going to be trying to move that fluid over to my opposite healthy side, down towards the healthy groin area, moving things up the arm because gravity wants to try to pull it down. So it is helpful to learn that technique just to be able to have an extra tool at home you can utilize to prevent lymphedema. All right, now appropriate exercise routine. You want to and should exercise that side that's at risk for lymphedema. It used to be told to patients who were at risk for breast cancer related lymphedema, do not use that side, do not use that arm, don't exercise with it, don't do anything. And that has been debunked, okay? They were telling individuals that that's going to cause your lymphedema. Now, mind you, I already mentioned before that aggressive, repetitive activity can stir up the possibility of lymphedema, but that doesn't mean I don't want you to use that side. You just need to know what's the right activity level, the right exercise routine, and prevention measures like wearing the right compression items to help promote normal lymphatic flow. So with an exercise routine, I mean, the thing is, do I want you going out and doing heavy duty weightlifting with, a ton of weight? No, I don't think that's something that's going to help your lymphedema and could possibly put more strain on it. But very light resistance training, stretching mobility routine is helpful for the lymphedema. I've read studies where it's talked about By doing an appropriate level of intensity with a strengthening and mobility routine for that at-risk side can reduce your risk of lymphedema, because you're training that at-risk area to be able to handle more of a caseload and larger workload than what it does on a day-to-day basis. Like when we, go put the dishes away, we do laundry, we're writing, checks for bills or whatever have you. If you train that side the right way, then your day-to-day stuff will be no problem for it. It's just finding the right balance between the right kind of exercise versus too much aggression. Finally, monitoring for potential lymphedema symptoms. And this again will vary. We talked about with stage 0 lymphedema, how you won't necessarily see swelling, but the most common thing I hear individuals tell me is that in their at-risk area, especially the arm, they start feeling a heaviness sensation, tightness, pressure, not pain necessarily. Realistically, lymphedema is not a painful condition. The only time it will get painful is if it's been allowed to progress to the point where it's affecting the skin, it's affecting movement and mobility of the arm and shoulder. But in and of itself, it's not a painful condition. But you might notice jewelry, clothing starts fitting a little more snug, and all of these things are happening on that one side and not on your opposite healthy side. Okay, so I kind of dived into this a little bit, or dove into it a little bit already, but signs and symptoms of lymphedema. So obviously swelling, right? And this could happen again in any part of the arm, upper chest, upper back. I've seen individuals that have lymphedema in their arm, but it's not the entire arm. It may just be the hand and wrist, forearm, elbow, biceps, or it could be the whole thing. It may just be the chest or the upper back that they're experiencing it in, or all areas. But you will start seeing actual visible swelling that you don't notice on your opposite side. And then just a review, we've already talked about a sensation of heaviness, tightness. Fatigue is another one that I've had many mention on that at-risk area. The tighter fit of clothing or jewelry on that side. And obviously you want to make sure you're not wearing your clothing or jewelry too tight to begin with, but we're basing this on what your normal size is with these items. And that again, you notice these changes happening on your side that's at risk for lymphedema. Now, you may notice that the symptoms worsen the more you use the at-risk side. And I don't want this to be confusing with what we talked about before, in that we're saying we encourage you to use that side. But this is, again, if you haven't gone through preventative treatment or active treatment and you're just going about using that side like normal, but no prevention strategies or treatment management strategies have been brought into play, then yes, the more you use that side, you may notice your symptoms become a little bit stronger. Then we go into those skin changes. Even besides the more advanced skin changes, really right out of the gate, you may notice the skin is very dry on that at-risk side. That's one of the most common things that you'll see in that area that is not present throughout the rest of the body. All right, so treating lymphedema, okay? Now we incorporate these components even with our preventative treatments as well. But formally treating lymphedema is done through complete decongestive therapy, otherwise known as CDT. Now, legally, from my understanding, you don't have to be a certified lymphedema therapist to do lymphedema therapy. I think you should be seeing certified lymphedema therapists. And I can say that only because I know what my knowledge was before becoming certified and trained versus what it is now. And this is why I highly encourage, if you know you're at risk or have lymphedema, it needs to be a certified lymphedema therapist that you are actually seeing for assistance. So we go into manual lymphatic drainage, which we've chatted about already before, that very light hands-on technique. I want to mention with it too that with the lymphatic drainage, It's such a gentle technique. And honestly, it's relaxing when it's done on you. It really is. But the reason why we go so light is, again, we're trying to mimic the natural movement of lymphatic fluid in the body. But where lymphedema tends to swell and accumulate is in the superficial lymphatic system. We're talking a millimeter underneath the skin. So you don't want to nor need to push hard to move this fluid. That's the manual lymphatic drainage. There are more advanced techniques that a lymphedema therapist will perform, but then you should be taught a very basic standard technique for home practice too. We will go into skincare, especially if you've already started noticing skin changes, such as that dryness. Making sure you're in a good regular routine with non-fragrance lotion is recommended. We want to keep that lotion as neutral as possible to mimic the pH of the skin. So no Bath and Body Works, okay? Keep it as neutral as you can. So that's typically with a fragrance-free lotion. And that might include Aveeno, Eucerin, Aquaphor, CeraVe, Vaseline, just to name a few examples. And then if you do have more advanced skin changes, those actually will start to typically improve and sometimes can even resolve themselves after you've gone through the appropriate treatment regimen. Now we're going to exercise because, again, you need to learn how to use that arm. If you don't use it, you lose it, right? You need to use that arm, but you need to know the right way to use that part of the body without triggering your lymphedema and allowing it to get worse or making it come on to begin with. Now, the compression garment use, if you are coming into therapy and you've had swelling that's been present for a while now, maybe it's been a few months, a year, even years, you may not be able to jump right into wearing a sleeve. And this is a big misconception where many have been told, just go get a sleeve or, a glove, just throw that on and that'll take care of it. If you've advanced to the higher stages of lymphedema, especially stages 2 and 3, a compression sleeve, a glove, even a bra alone aren't going to do the trick, especially when it comes to the arm having lymphedema. The gold standard with CDT is actually to bandage the arm when you have advanced lymphedema. And this is not just ACE bandaging. This is a very intensive bandaging routine that involves a type of bandage called a short stretch bandage. It has a higher working pressure compared to ACE wrap and is considered more effective for containing lymphedema. But there's other materials involved, such as using cotton or foam materials that will help break down those skin changes and soften the skin and create more of that normal proportion back in the arm again. So many times bandaging may need to be done for anywhere from 2 to 4 weeks until you can maximally reduce the swelling, get it to a stable point, then get into your long-term sleeve, glove, or whatever items you're needing. There are alternatives to bandaging nowadays because bandaging is very difficult to do yourself, and many times individuals can't replicate this themselves. So you will often now see Velcro wraps that are used, and these have been shown to be just as effective as bandaging, but a little bit more functional to be able to use. But again, the goal is to get your swelling as stable and reduced as possible, then transition you to a long-term compression item. So if we're talking about lymphedema in the arm and we're looking at a compression sleeve or glove, you may reduce to where you can have something ordered that's just off the shelf, a very simple item. But if you started with very advanced lymphedema and it improves, but it can only improve to a certain extent because of how severe it was to begin with, you may require a custom item, something with a more advanced fabric, and that is specific to the shape of your arm because it's not able to fit into something off the shelf. Same thing goes for any trunk pieces that might be needed, such as a compression bra. They also do have compression tanks and camisoles available too. Other tools and equipment may be used in treatment, such as compression pumps, pneumatic compression pumps. There are also taping techniques that are available, with all of this just aiming to help give a kickstart to that congested fluid region and move it into parts of the body where the healthier lymphatics can help take over. Okay, so we're looking at our key takeaways here. When you know that you are at risk for breast cancer related lymphedema, you need to speak with your doctor about a referral to a certified lymphedema therapist. Now, many oncology groups have become very proactive with recognizing there's a risk for lymphedema. I want to refer you to a lymphedema therapist to learn what to do, or recognizing when it's starting and refer you to a therapist. But there's still, like I say, are too many individuals I've worked with directly that have told me they've never even heard of lymphedema. So that's where you want to be proactive. So whether it's you, someone you know, if you know they've been given a breast cancer diagnosis, just talk with them about, has anyone mentioned the word lymphedema? Okay. Very severe cases with more advanced cancer staging can actually cause the lymphedema to start itself. And that can even be a sign of cancer, but those are very severe circumstances. Typically, if it's going to start, it won't be until after your treatment has started. And this may include surgery or radiation or even chemotherapy too. Now, you want to make sure that you learn and implement prevention strategies before the lymphedema has even had a chance to begin. Because then, even if it does possibly start down the road, it's probably going to be a much more mild situation versus if you hadn't even taken those prevention strategies. And like I say, you could very well be giving yourself a chance to never develop lymphedema, which would be fantastic. If you notice any signs or symptoms concerning for lymphedema, speak with your doctor and a certified lymphedema therapist immediately. Don't wait to see if it goes away. Even that sensation of maybe some heaviness or tightness, or your clothes fitting a little more tired, you're getting more fatigued on that particular part of the body, that could be lymphatic fluid building. So make sure you tell this to your medical provider. Now, if you are living with breast cancer related lymphedema, please be consistent with your home program. You may successfully go through complete decongestive therapy. Your swelling is looking fantastic. It's under control. Maybe you even get down to a stage 0, which is possible if it's caught early enough. And because it's looking good, you're feeling good, you start maybe not practicing your home program as diligently as you had been, because you're doing great. So why have to stay on top of it as much? But if you eventually get to the point where you stop doing things altogether, that's again increasing the chance that it may return again. So if you've been taught those strategies, make sure you're keeping up with them at home. Now, we do want to talk a little bit about and mention to you that RangeMaster does have a breast cancer recovery kit that really tries to address all the possible musculoskeletal and physical side effects that you may experience with the diagnosis of breast cancer. This is related to if you have lymphedema, which can affect shoulder and arm mobility, or if you have had surgery for removal of cancer, such as with a lumpectomy or mastectomy, and you know that range of motion and strength on that side is not that great. So in our kit here, you can see that we have the shoulder wand, we have the over-the-door pulleys, and the shoulder fit resistance exerciser. So you're working on shoulder mobility, flexibility, strength, and stability all in one. So this is to try to help you with moving through the phases of recovery after surgery for breast cancer, obviously after you've been cleared to resume exercise. And it's even better if you can do this under the guidance of a physical or occupational therapist, especially one that's a certified lymphedema therapist too. But research does show that gentle stretching and strengthening, range of motion progression during and after breast cancer surgery are definitely safe and beneficial for eliminating or reducing any upper limb or shoulder impairments. And this is more information that you'll be able to find on myrangemaster.com. All right. So that is the end of me talking. So please, if you all have questions, please go ahead and you can put them in the chat box and we'll start going through them.
Thanks, Dr. Shelby. We do have a couple questions, so I'll go ahead and read them off to you so that you can kind of address those.
Okay.
Posted, I have breast cancer-related lymphedema, and your products were recommended by my PT. I'm delighted with the information in this presentation. She also recommended a bra that has lymphedema channels, and that seems to help. She is wondering, is that bra similar in function to the sleeve?
Yes, and that's a great question. The compression bra is often forgotten about. Now, I'll be honest with you, if I have someone in a preventative stage with their swelling and they're concerned about their chest or upper back region, sometimes a straightforward, perfectly fitting snug sports bra can do the trick. But I'm still always going to be in favor of having at least one actual medical grade compression bra. There are a few different, not as many as compression sleeves, but a few different manufacturers that do make medical grade compression bras. My personal favorite, I'll be honest for you, and I get, nothing from making this recommendation. I'm not getting, any monetary incentives with it, but Prairie Wear is a company that I found. I love the material. It feels just like a sports bra. It gives a nice wide back. Majority of the compression bras you see will have a zipper in the front just for easier ease of putting on. But the way that it's built and manufactured is similar to the concept of a compression sleeve, and that it's giving graduated compression to help drain the fluid from that area. But besides Prairie Wear, there's also Wear Ease Compression is another good company, and they even have compression tanks and camisoles that you can wear too, so you have a little variety with that.
Excellent. We have a question here from Marcia. She says, I'm scheduled for a lumpectomy without a lymph node removal. My surgeon mentioned the possibility of lymphedema. Do I still need to take the precautions you are suggesting? She's specifically concerned because she can't take blood pressure or blood draws on her other arm.
Okay. Yeah, and that's a great point too, is if for another reason you can't have those vitals taken on an opposite side and you're out of arms at that point, what do you do? With a lumpectomy, if you're not having lymph nodes removed, it's again a small risk, right? I can't tell you there's no risk, but there is a small risk because of the lymphatic vessels that are in the breast tissue. This is something that options that you have when it comes to blood pressure, you technically can have your blood pressure taken in the calf on one of the legs. It's not considered as accurate necessarily, but that is one option. And then I've had some individuals that will choose then the lesser of the two evils when it comes to either arm. What's considered the worst case scenario, and what arm definitely cannot have these vitals taken. I would talk with your oncologist or surgeon about that too, because as a medical doctor, they will probably have more in mind as to other ways that they can access what they need for lab draws, possibly something different from outside the arms. And again, with the blood pressure, what their suggestions are for it. But it's definitely a tricky situation when either arm is considered no good to take those vitals on. But there usually has to be some workaround for it. So I would definitely talk with your surgeon or oncologist about it.
You're muted, Julie.
Fantastic. Hello, welcome. I was just letting people know that for those who joined late, there is a little chat button at the bottom there, little chat bubble on the lower right-hand side. You can click on that, and in there you can add in any questions that you might have. There's also a couple links that Eric put in there for you guys as well. Link to our cancer recovery kit, as well as a coupon code in there for you guys as well. But I just wanted to give a big shout out to Dr. Shelby. Thank you so much for your time and sharing all that knowledge with us. It was an incredible webinar, and we're excited to have this, especially for playback for those who join a little bit later too. As Eric put in the chat, it is recorded, so you guys will be able to refer back to this. RangeMaster U as well, so the platform that this is on, has a ton of articles and information that Dr. Shelby has written talking about breast cancer related lymphedema, and just a bunch of resources on that for you as well. But thank you everyone for participating and coming. We really appreciate it. And thank you again, Dr. Shelby. We appreciate your time.
Thank you guys.